start again. Welcome everyone to the information session about the Master of Medical Informatics. My name is Floris Wiesman and I am the Program Director of the Master of Medical Informatics, and I'm also a course coordinator and teacher. And with me is Cheng Lu, and she is a student in the program, and she will tell later more about her experiences in the Master of Medical Informatics. But first, I will explain more about the field of medical informatics, and then I'll go to the actual program. So currently in healthcare, we have many challenges, and I'd like to highlight two of them. The first one is the problem of the aging population. So for instance, in the EU, for each elderly person, there are 3 people working currently in 2023, working and earning the costs for this elderly person. But this will get worse over time, and the expectation is that this will drop from 3 to 2 in the year 2050. So we really need to reshape healthcare to make the whole healthcare system affordable. So that's one problem. And the other problem is the problem of information overload. If we look at internal medicine, for instance, a doctor in internal medicine needs to know and learn 2 million facts. And already 20 years ago, this meant that doctors had to read about 20 articles per day, scientific articles, to stay up to date. And as the literature doubles every 19 years, you can imagine that nowadays this is really even more impossible than it was 20 years ago to stay up to date. So we really need to find a way to deliver the right information at the right time to the right person. So these are challenges, and medical informatics cannot solve these challenges, but can help address these challenges. So we really need medical informatics to get to start helping solve these problems and improve healthcare. So what is medical informatics then? It's a broad field. Let's first have a look at a few topics that are part of the medical informatics field. First one is quality indicators and quality improvement, which is about how to improve the quality of delivered care. Logistics is about improving processes in healthcare, for instance, optimizing the processes of admitting a patient to the ER and treating the patient. Evidence-based medicine is about finding the best treatment possible for a particular problem and also really using this treatment. Clinical decision support is about the information overload I mentioned earlier, where we help the doctors to make medical decisions by providing information by the computer. Image processing is about processing the images that are, for instance, generated by MRI scanners and analyzing them. Data science and artificial intelligence are about analyzing the vast amounts of data that are generated in healthcare, for instance, hospital, and finding patterns in them. Healthcare policy and management are very important for the interaction between ICT on the one hand and large organizations. On the other hand, how does this interplay work? Interoperability is about making sure that the myriad of systems that are available in healthcare can exchange information and understand each other. Usability and user experience is about designing systems that can actually be used by their users and in such a way that they make no errors. For instance, we don't want doctors to enter a wrong blood type because it can have very adverse effects. Telemedicine is about delivering healthcare in a way as we are now doing here, broadcasting information and having a teleconference between doctors or a doctor and a patient. And information for patients is about delivering information to patients in such a way that they also understand what's being said. So these are several topics in medical informatics, but let's also have a look at the levels that medical informatics operates. So we have at the lower levels, the infrastructure, applications, and information. These are really technical views, technical approaches to the problems and the subfields that I mentioned. But if we look at the higher levels, the care process, policy, legal, and regulatory, it is less technical and more organizational. And we need all these levels to understand the problems that we address in medical informatics. Medical informatics operates at the level of individual patients and caregivers, but also at the level of departments, at the level of entire hospitals, and even at a level above that, so where we look at the whole healthcare sector, where we have hospitals, GPs, citizens, pharmacies, health centers. So as you can see, our playing field is very large, very important, and really worth studying and starting a career in. So that was my brief introduction to the field of medical informatics. Let's now have a closer look at our master program. So the Master Medical Informatics is taught in the Amsterdam UMC Medical Center, one of the largest hospitals in the Netherlands. And this hospital comprises 2 locations, and we are at the location AMC. Here is our curriculum. Our program consists of 2 years. As you can see, year 1 is more specified than year 2. I will go through it very briefly because we can later zoom in on the different courses. But for the general idea, we have in each year, we have 2 semesters. In the first semester, you can see the courses MOM 1, 2, 3, and 4. As you can see, the names of our courses are very long. So that's why we often refer to them, not by their titles, but by their codes, MOM 1, MOM 2, MOM 3, etc. So we start in semester 1 with an introductory course, and then we have 3 courses that together we call the data science track. And track may suggest something it's optional. No, these tracks are compulsory. So they just define a cluster of related courses. So we have the data science track of 3 courses, and then we have an internship. And in parallel, we have another course running, and you can see that on the left-hand side, and that's the academic skills course about scientific analysis and reporting. So this course runs in parallel with these 5 courses. And then the second semester has more or less the same structure. Again, single course, then 3 courses of a track. In this case, it's the management track. And then again, a short internship. And in parallel, we have another academic skills course running, the management communications course. So that's the first year. Then we have the second year. And in this year, you have several elective courses, more about them later. And then you have your scientific research project, where you do your individual research project and you write your thesis. And then you have completed your master program. The internships and the scientific research projects are important parts of our program, and the great thing about them is that they, in principle, they are carried out, or they can be carried out in our hospital. So you are really immersed in the hospital. This is not a program somewhere at the university which is not related to an actual hospital. No, you are studying in a hospital. So that also provides a great opportunity to do your internships in a real hospital. To give you an idea of a few topics of scientific research projects to see what our students are working on. I have a few examples of them. The first one was by Susanne Hors, and she looked at COVID patients at the emergency department, where she optimized the process there. Another project by Juri Broekhuizen. He did his SRP, his scientific research project at the company, and there he looked at how to keep users using mobile applications. And then a project of Ines, and she did her SRP, an international one in Ghana, or at least it was supposed to happen in Ghana, but as you can see, that was in 2021, so she couldn't visit Ghana, and she had to do it from home, but in principle also international scientific research projects are possible. And then Checo Jordanov, he looked he did a data science related project where he looked at many hospitals and tried to predict the outcomes of a particular surgical procedure. I'd like to mention that our university, the Universiteit of Amsterdam, the University of Amsterdam, is a top 100 university in several prestigious rankings. So the Times Higher Education ranking, the QS rankings, and the CWTS Leiden ranking. In all these rankings, our university is in the top 100. And our master program was last year awarded the best IT master in the Netherlands outcome. So if you have done our program, what are your future prospects? Well, every 6 years, we ask our alumni how they are doing. And these are the results of the last questionnaire that we had. And we asked how long they searched for a job. And that was very well. As you can see, 88% didn't have to search for a job because most of them had already found one during their internships. And then we ask, where are you? What kind of job do you have? As you can see, most of them are employed at an employer. A few of them were still students or had their own company or did a PhD. But most of them are working somewhere. And where are they working? About half of them in healthcare-related IT jobs, several of them in research, or in healthcare, but not healthcare IT, or in IT, but not healthcare-related IT. But as you can see, a very large group is working in healthcare-related IT. And we also asked, what is your function? And this is quite diverse results. So some are consultant in medical IT, or manager, project manager, system architects, researchers, software developers, information managers, and lots of other answers did we receive. So it's not a particular answer as you would get if you ask at a medicine master, where the answer just would be doctor. We have many answers here. So in summary, our medical informatics master combines IT, healthcare, and organizational aspects. We have great career perspectives. We have also very prestigious and inspiring faculty. We have a very small program, not too many students, and it is in the great city of Amsterdam. Okay, that is me, a teacher talking. Let's now hear from a student, and we have here Cheng Lu.
Yeah, hello. My name is Cheng Lu. I'm a second year medical informatics student right now. I've done the Bachelor of Medical Informatics as well, also here at the University of Amsterdam. And besides a little bit about me, besides study, I love to play the piano, so a lot of instruments. I played 14 years the violin, but I still love the piano more. I also love traveling, and what I've also been doing this year is I'm also the year representative.
Hij stond net de hele tijd aan, dus. Okay, sorry. Can you hear me now? That makes more sense. Sorry. Okay. Well, I will just keep it short. I've done the master, and now I'm a second-year master medical informatics student. And what I was trying to say is, besides studying, you can do a lot of things. For example, being a year representative, where you can share your feedback about the course with some other students. But also, I've done during my first year of the medical informatics, I was also a student council representative. So yeah, there's lots of things you can do.
That's well.
Oh yeah. So things what I'm doing right now. I'm an intern at Chipsoft. So my scientific research project where Floris talked about, I'm doing it at Chipsoft. I'm currently how you say it, like I'm validating a questionnaire which is being used for to test how good the software is with the usability.
What is Chipsoft? Is that
good one. Chipsoft is the how you say it, the electronic health record maker of the HICS. So health, I don't know what it stands for, but just the electronic health record for some hospitals. And yeah, if you can tell, okay, I will just share more of my future plans. So what I'm thinking, what I will do, hopefully I will finish my master's so after this study year. And then I think I want to first try to find out, like, maybe the consultancy will be more for me to be working at, but I'm still debating what I want, but I think I would just try that of other positions. At least I want to try to work in an IT company, and maybe I want to follow a traineeship. Maybe I want to educate myself a little bit more into becoming an expert in some field, but I'm still not sure what I want to do. So it's still for me to figure out.
You have some time.
I have some time. I still have some 7 months, I think. And after that, I will see what I will do. So I think that's my slide.
Yeah, still your slides.
Yeah. Okay, thank you. So for the medical informatics, so I'll tell you, it's only located at the Amsterdam UMC location AMC, so it's at the hospital, which I loved actually, because during my breaks you can just walk into the doctors, and they all have operating room clothes and whatever. And it's an academic medical center, so it means you're intertwined with not only the students but also the experts in this field. So, for example, our teachers are also working here, but also doctors. So the lines are very short. You have around 1,100 beds in this hospital, and that's roughly take into 7,000 employees. So for the structure, so I'm not sure. Yeah, you've seen the course settings. So each course only lasts 4 weeks, and then you will pass into a new course. And there's not a lot of examination. We have only 2 tests to be during MAMO 5 and MAMO 7. So the rest of the examination will be done with some projects. So you need to write something, or you just doing something with your group, and you need to do some presentations. It depends each course what you need to do. You have the weekly assignments. Some courses do have more that you need to, for example, MAMO 2, you have each week a small project which you need to handle at the end of the week. As I said, you have presentations because you also need to keep up your presentation skills, not only for example, this, but also for later in the work field. And yeah, a good thing about the master, if you don't like to study very hard for exams, then this is your master because you only have 2 exams. Then the structure, yeah. So yeah, how it looks like. On Mondays, we always have the introduction of the course. You also have some tutorials, the werkgroepen, and you will get some knowledge about what you need to do for the rest of the week. And then on the Tuesdays or the Thursdays, you can work on the assignments, but basically you can do it whenever you want it, wherever you want it. So you will only be at school for Monday and Fridays. Sometimes you might need to come on the Wednesday for one time, but that's depends on the schedule. And on Fridays, you always have the deadlines, or you need to present your results. And you also some courses, yeah. So as the last line is saying, some things you have to do it on another day, and then you need to get to school for that day.
Yeah, so this is mainly for the first year. The second year, of course, depending on the electives that you're following, there may be also lots of education on Tuesday to Thursday. So this is basically the idea for the first year.
For me, for example, for the second year, I only need to go to school on the Monday because also my SRP started, so my scientific research project. So mainly I will be at the company where I'm doing my internship, and the other days I just Zoom online with my group mates, or if we want to team up here, then we could go to the AMC to study. Yeah, so a little preview of how my week could look like. This is for the first year. So yeah,
it's February. That's my course.
Yeah, that's your.
Yeah, that's my course.
Yeah, so on Mondays you have all the lectures. You will learn the basics, and then on Friday you might need to present, or you need to do some assignment things. But as you can see, the rest of the week you can decide for your own where you want to study. So it's very flexible. And the courses.
Yeah, so let's have a look at the individual courses. And I was going to say if there are courses that you didn't follow, but well, you followed, of course, most of the courses. Let's see how far you can get. This is Mom 1. Do you still remember?
Yeah, so there was
a year ago.
Yeah, it was a year ago. I still remember some. I cannot say if I remember all the courses, but I will try. For the first course, first year, you learn the basics of how you can define which articles are good. So you have some criteria and you have a checklist, and you basically learn the basics how you use the checklist to define if an article is good enough or not.
Articles in medical informatics and in healthcare. Yep.
Yes. Yep. Second course. Okay.
Second course.
Fundamentals of data science.
Fundamentals of data science. Yep.
Yeah. So basically, you learn. It's a little bit statistics. So you have some regression and some things like that, and it's mainly in R programming. And more than that.
And some Python program too, I think. I'm not sure.
I didn't do anything.
No, not in here. Okay. So this is the first course of the data science track of 3 courses. Yeah, and then we have the second course there, Mon 3.
Yeah, Mon 3 is based on Mon 2, but then you go a bit more advanced. So therefore, the course is also called Advanced Data Analysis in Medicine. So therefore, we looked into the maximum likelihood theory, the variation methods, so a little bit of mathematics in it, but not that you need to do it on paper, but how you do it on R in this course. And also bootstrapping and multi-level analysis. Yeah. Maybe.
Mon 4.
Mon 4. What did I do? Oh yeah, Mon 4 has like 3 different paths. So it depends on which path you
choose.
Yeah, you choose or divide it. So you have one that is more about decision support. That was my part, what I did. So I made a decision tree about what kind of medication you could use and decide like what is the best, basically. The other parts, maybe you can explain in a little bit.
About
There was one about
medical decision making. I think was more about. I think that's the Bayesian approach to making decisions. And then terminological systems is about the idea that you can really define medical terms that you use in systems, and you require that to make systems interoperable so that they can understand messages that they exchange with each other. Short internships. What did you do for your internship?
So the first internship was at the Department of Medical Informatics. I had like the website of the Alzheimer's Center. I researched like how their usability was with some heuristics a PhD defined. So mainly how the usability was on a website. And it was a 4 weeks course. So I just combined with the heuristics and the website and try to figure out what kind of usability problems there were on the website.
Yeah, so the idea is really that you tag along with an existing research project and do some work there. And since it's only 4 weeks, it will not be much, but you can really contribute to an existing research project. Yeah,
because my project was also being used by another bachelor thesis later on.
Oh.
So yeah. Yeah, that's Mammal 5.
That's my course. Should I explain that?
Yeah,
that's the course that I teach, Biomedical Information Systems Engineering. It's a quite technical course where we look at technologies that are used for building large information systems in healthcare. For instance, microservices, cloud computing. And we also look at how you can assess the suitability of a particular technology for a particular application. And we do that with 2 approaches. We look at the literature, and we also do this by trying it out. The students, they build a prototype, and then they evaluate the prototype to see how suitable it is for the problem at hand.
And Mammo 6, yeah. So that was organizational settings and innovations for sustainable healthcare. So we learn a lot of courses about some technology, some how you use data and stuff, but you also learn there's also a course is more specific to how can you make some parts of the hospital more sustainable. And in this case, my project was with the water department of like how the water use was in the hospital. We tried to research like what are things that could be done more sustainable. For example, the taps of the water that they are automatic and stop at some point. You are going to save more water than if you just maybe let it open and forget to close it. So things like that, you can think about it. But it was mainly also to teach you like how does the structure work of the hospital. Like you also have like some parts of that in it.
Yep. So this is the first course of 3 in the management track.
Yeah.
Yep.
Then the healthcare logistics. That's the part that where some, not mathematics, but really the logistics of how e-health in the health, not e-health, but how healthcare, how you combine it with some logistics. So for example, what I've learned was that during the operation room planner. Yeah, I think that was that course. So we learned how we can predict, like not predict, but how do you plan an operating room? Because you can imagine the planning is quite full and some things are more urgent and needs to get into the schedule in between. How you manage to do that, and also some basic knowledge about what kind of methods you can use. Yep. But you will learn it.
And you use mathematical techniques to find an optimal or a solution. Yep.
Yeah, and then the healthcare management. I'm very much thinking what I've done.
So it's the course about where you learn how an organization, the IT, or the goals of an organization can be addressed or helped by the IT department, right? And how you organize your IT department in order to help the organization reach its goals.
Yeah. And then the short internship too. Well, for me, that was not 4 weeks because you could do it kind of combined, but I didn't need to do that. But I had a very nice internship where I could also publish an article, and that article is now accepted, so that's very nice. What I've done was I learned, so during my bachelor, I already started a research about how the usability was of a online platform for emerging youth with mental health problems. And after that, I could do my second internship with that. And with that internship, I also researched the whole research of a PhDer. So basically from the basics from the start of how they try to get participants to participate in the study, and also the research about what the outcomes of all the participants were. And that data, we summed it up into one article, and we presented all the research what has been done in all the 4 years of someone's PhD. And I mainly also help with the graphics, how to make it more visible in the article. So that was my internship too. A little bit different than what most people could do, but
yeah, that's not really normal
no.
that you make a publication in your internship. Of course,
especially not with 4 weeks.
Yeah, that's really unusual, but very nice. Yes.
So you can get more out of it than only a 4 weeks internship. And then electives.
And with the electives, so for the electives, there are 3 possibilities. You can choose one of the elective tracks. So we have 2 elective tracks, AI for Health and Sustainable e-health Solutions. AI for Health is about, well, using AI in healthcare, as you can imagine. And this is a track of 4 courses, and we do this together with the AI masters of our university and the Free University of Amsterdam. And this track comprises 4 courses, a brush-up course to make sure that our students are more or less at the same level as the AI students, because you really follow these courses together with the students of these 2 AI masters. And then we have a course about medical image processing, a course about natural language processing, and also some image processing, and about machine learning and reasoning for healthcare. And the other elective track is the Sustainable e-health Solutions.
That's the track that I follow.
Yes,
so,
maybe you can explain that better.
Yeah, so basically what we're learning, the first course was about what kind of user experience research are there, and how do you use, what kind of methods are there to research that. And that course was also combined with like a project where you really need to make from an idea into like prototypes of how you can test the prototype. So for my case, I had a guy who is in a wheelchair, and we're trying to find a solution for him to to find a solution to make his life easier. So basically what we've decided to make is a wheelchair plus smart wheelchair idea, that he can use his tablet, because he has cerebral palsy. So it means that he has like little he has hard time with some mobility, but basically he can use an iPad, and then on the iPad he can decide where he wants to go, and then the smart wheelchair will bring him to the place. That's our idea. And then the second course was the evaluation of technological impact. On that course, we also had the collaboration with eHealth Lab. So on that course, we learned how the eye trackers worked, how face recognition and emotions from it. And we also use that to test our own made product, basically.
So with eye trackers, what can you do with eye trackers?
So you can see where, of course, the people are looking on a website, for example, but also there's a new smart software in it where it can detect. That's the face recognition part, and then it decides like, oh, you're smiling, so you might have a happy feeling, or you might be a bit sad or angry. So that was the face recognition.
And why is that relevant? What do you use it for?
Where do you use it for? I think mainly if you're using if you're trying to reach somewhere on a website, you want to know if that's frustrating or not for some people. So if you can see, like, for example, someone doesn't know where to click because the icon is not logic, or you don't know where to go, or so the usability of a website. And if you see someone's very frustrated, then you can tell something, oh, maybe that button is not clear enough. Yep. And you need to do some changes on it.
Okay. And with our new eHealth lab, we have the hardware to do that research and to really see how our patients and healthcare workers react to the software. Yep. So that's the second option, this track. And the third option is that you choose courses from other programs at our university or another university. Please note that you can only follow our 2 elective tracks if you start your studies in September. It's also possible to start our program in February, but then you really have to choose courses from other programs here at the elective part. Okay, that's the elective parts. Then a little bit more about the scientific project. So your work at Chipsoft is that is your scientific project?
Yes, that's my scientific research project. So it's the first time that I'm, for example, working in a real big company. So I get to know the work life from 8 or 9 till 5. So it's quite hard. You need to sit a lot on your desk and But basically, my scientific research project, I already told about it. So it's a validation of a user test, or not user questionnaire. But I will also, in addition, I will also do a user test, and therefore I will just also try to find some usability problems of one of the hospital's processes. And I think it will go for the. I think we will go for the aanmeld kiosk, so it means like the check-in kiosk, so where you the machine where you, if you enter the hospital, you need to check in, and maybe that layout, but we have to decide it still. So during the scientific research project, I still have another course. That was the third course that was stated on the sustainable eHealth track, and that's the Green Lean Deal. And for that course, we're actually trying to teach the Lean Six Sigma, how the work process of that method works, and how you can think to make something sustainable, but with that method. And for example, right now, I just was at the gynecology department, and I could watch how an operation went, and also see how much waste there was being used. And so I was literally counting how much surgical gloves that were used. So it depends on which project you're doing, but for my project, we are thinking, how can we make the gynecology department more sustainable?
Yeah, so you're really visiting a department in the hospital and improving their processes. And for your research project, you're working on the actual software that is used in hospitals, the most important system, the electronic health record system, making improvements to that system. So your work really has, your study really has an impact on the healthcare system. Academic skills, well, we already talked a little bit about that, I think.
Not really.
Okay.
It was during the first year mainly, and then it's separated into 2, AS1 and AS2, and it basically teaches you how do you do scientific research, what are skills that you need, also for in the working life, but also just for school academic skills. So how do you write a paper, how do you present, how do you, for example, in the management part, how do you pitch to a board, how do you convince people, and how do you write advice report? So what I will also be doing for my SRP is write an advice report. Before that, I had no idea how to start, and now I have at least the basics on what should be in an advice report. So that was a course that was during the first semester and the second semester, and they focused on the topics. And they were really useful.
And you also had some practice with that, right? Pitching to boards.
Yeah. So that was mainly during Momo 7, I can still remember, but it was also during Momo 5, I think, or I forgot. But at least we needed to pitch how to convince the hospital management to use what kind of operating room schedule, and we had to use the logistics, and we programmed an OR schedule, and then you need to convince the hospital board like this is what we think is the best.
In a way that they really know what to do, and although they don't understand the technique, right?
Yeah.
The technology. Okay, shall I take this over? So we're now looking at the admission requirements. If you really like what we told and you're thinking about joining our program, then let's have a look how you can get in our program. There are some requirements for being admitted. The first one is that you have either finished the Bachelor Medische Informatiekunde, or if you didn't, that you have a relevant background. So maybe you studied medicine or maybe computer science or pharmacy, or biomedical engineering. And you have some, hopefully you also acquired some academic skills in your previous studies, and you are motivated. Then you can enter our pre-master program. And in the pre-master program, you will acquire the knowledge that you need in the master. And if you are a non-Dutch, non-native English speaker, you also need to pass an English proficiency test. The pre-master program, to get in the pre-master program, send an email to the address. We will put the address later in the chat. To get more information, and then email your application. And then it will take some time to evaluate your information, your application, depending on whether you're a Dutch student or you're from abroad. And that the last category, of course, takes more time. And then we'll see for which courses you may get an exemption. So, for instance, if you did first computer science studies or AI bachelor, then you will get an exemption for the courses in the pre-master that are related to that program. And once that is established, which courses you need to follow, you will pay a fee depending on the number of courses, and you sign your contract, and then you can start with the pre-master studying and taking exams. And once you're finished, and this will take in principle 6 months, and once you're finished, you can enroll in our master. There are currently 2 possibilities. We have the, let's say, because we're moving to a different approach for our pre-master program, we have the old pre-master program, which you can still join if you register before March 1. And that is only for students, European students, so Dutch and European students who really have a relevant bachelor and who want to start in September 24. And they can, if they want, join the old program, and the old program is only self-study. So you will do, you will read literature, you will look at video lectures, you have access to a digital library, and then each month you can come to the AMC and do exams. And if you are not living in the Netherlands, you can do online exams. And you can contact lecturers every time you have questions. And this whole conversion program, this pre-master, takes at most 30 European credits. But hopefully you will have several exemptions, and in that case, of course, you have fewer credits. But the new approach, if you do not fall in this category, so for non-European students, or you want to start later than September 24, Then we have a new program. And in this program, there's also self-study, but there are also contact hours. And you cannot choose the exam days, but we have fixed dates for everything. So you start in September, and then you study for 6 months, or you start in February, and then you study for 6 months, independent of whether you have many or a few exemptions. Whether you do the first option or the second option, the result is that you will get a certificate, an admission certificate for our master. And in both cases, the workload is 6 months of full-time study. So don't underestimate this. It's really a lot, especially if you are doing only self-study. It takes a lot of dedication to finish this. Topics that are in the pre-master, well, I will not go through all the topics, but as you can see, there are several topics from, let's say, computer science, so that's the first block. Then there are topics on the right-hand side that are more like medicine related. And then on the bottom left, you can see that there are topics that are really medical informatics topics, so probably you won't have exemptions for these courses. And there is also an academic skills course. So that's our presentation. As you can see, there are a few links for information, and we will put them in the chat so that you can copy and keep them. And now I'd say the floor is open for questions. Do you have any questions?
Add something before any questions?
Yes.
Because we've only talked about like how the student life is, but there's also student life besides studying, which I've talked a little bit about, but also maybe I can introduce our study association, which we have. That's Medica. So that's only for medical informatics. And then you can have a lot of things that they organize. So you have, like, for example, the lift weekend. So therefore you are just hitchhiking. Also gala, so like where you need to dress and have fun at a party and you drink. But you also have organization like buitenlandse reis. Need the translation of that.
A trip to abroad, to some country abroad.
Yeah. So there's a lot of things that our study association organize, and also every week on Thursday there's also our Epstein bar. That's a bar in the hospital where we can just also have a drink with each other, and then you also can encounter some medicine students and have a chat with them. So there's lots of do besides studying. I thought that was also nice to tell because I don't see them in the slides.
Good addition. Thank you.
Yes, well, we have one question from Michaela. How do you select your internships? Is there a predetermined list to choose from, or can you select a specific company or department for your internship? Yeah, Thank you, Michaela, for your question.
So for the small, I will answer the question. For the small internships, the teachers that are teaching you, they can clues about like, hey, I have an internship at this field. So if you like the topic of the course, they most of the time also have a small internship which you can approach. And also for their small internships, it's not allowed to go at companies yet. So you will stay in the academic field and learn more about any department which are in the hospital. And for the big scientific research project, there's a whole website on the, if you just search scientific research project medical informatics, you will reach that list. And then there's already a list with companies, departments of this hospital, and there's also selected on topics which you like. So therefore it's very easy to find it. But of course you can also find your own SRP internship place. So if you want to go abroad, there are some people who are going to Cambridge this year actually, so or London. You can find your way.
Yeah, we had students in many countries, so there are quite a few opportunities there. Yeah.
A whole lot of reading.
Oh, well, I have one short question to everyone. Is the audio still good? Because I saw a notification that the microphone has changed. Are we still hearable, or do we need to change something about that? Oh, audio is good. That's good.
Okay.
Well, a question from Yan Lee is: what are the requirements for the motivation letter, such as length?
Good question.
Yeah, it depends very much on your background. So if your background has nothing to do with medicine or the biomedical field, and also nothing to do with the computer science field or informatics field, then you need a hell of a description why you are still suitable for this program or why you're that interested. And the better your background is related to the medical informatics program, the less you need for your motivation.
All right, thank you. And then there is Bent, who's asking, I've asked the biggest and possibly only company that works in the field if having a health IT master's would increase my chances of getting a job in their company. The answer I've got is that I should just do a computer science master of science, because there are very low demand for this specific diploma because they work together with medical professionals. Is it true for this specific company? Oh, it's quite a specific question. Only or in general, it's hard to find a job in health IT outside of the Netherlands in the field of health IT in less advanced countries. Example, Hungary. I hope you can.
For the Netherlands, I would say, what is this? No. I think, it depends on the level of the IT development in healthcare in a particular country. If the development is very low, then yes, it will. Maybe it's more difficult to get a relevant job. I remember that 20 years ago, because our program exists for, I think now, almost 30 years. But 20, 30 years ago, it was difficult to find a relevant job in medical IT in the Netherlands because everything was still on paper. And maybe that's still the case in Hungary, and then I can understand. But in more, let's say, advanced countries, advanced as in regarding to IT, I think the situation is very different. And we see that our students here, but also in other countries, really find a job really, really quickly, and they are valued very, very much by the companies.
Yeah, I think the only barrier that you could possibly face is that some IT companies requires you to speak Dutch. That's because they're mainly focusing on some Dutch systems, but that depends on the company. But there's definitely a lot of companies that are open to international. So, and English is the language. So.
Yep.
Yeah.
All right, great. Thank you for your question. And then there is Luca with a short question. What's the suitable GPA in order to join this master or the pre-master?
Suitable, there is no requirements. So we do not require a minimum GPA. The higher the better.
There's no suitable. No. Just if you pass the pre-master courses, then you're qualified to do the master, I think.
Yeah,
right?
Yeah.
And what is the maximum that the pre-masters will cost in the first case scenario?
If you have the
financial
ECTs,
question.
how much will it
cost? Oh, I'm not sure. I'm not sure. I think it's in the range of something 40 or 50 euros per ECTS, but I'm not really sure.
And that times 30.
Yep.
Yeah. And what is the acceptance rate to the pre-masters program?
Oh, I'm not sure. I think it's I have no idea.
How many people started the pre-master and did not finish them? But that's not acceptance rate.
Yeah, it depends on starting. How do you find starting? Is it asking information or really paying the fee and then finishing? I think many people who start pay the fees, finish, but there are also quite a few who somewhere lose it because of the lots of self-study. And as I mentioned, in our new pre-master starting in September, we have less self-study and also contact hours. So we will hope that this will improve. We are sure, actually.
Well, thank you, Michaela, for your question. And yes, this meeting is being recorded and you will get the recording. And then there is M. Kramera asking what are some tips to learn Dutch effectively. And with that, we are, by the way, also almost at the end of the meeting. So if you have a question, ask it now, please.
I can maybe answer that question from what I know from the students I know that are learning Dutch. So what they are doing, mainly they're following a language course, Dutch course at the UvA, at the PC Hoofdhuis. They do have a floor with only learning people Dutch or other languages. And they just started from A1 and they're right now at B1, B2 level.
But to make sure, this master is in English, right?
Yeah.
So you only
don't need
good English.
Dutch.
You don't need Dutch, but it is, of course, helpful if you're chatting with other students or people at the hospital. Then it's really useful. And indeed, if you want to work at a company, then you're really going to need to learn Dutch if this is a Dutch company.
I think a good start might just be Duolingo, probably.
Duolingo is a good start.
Yeah. Yep. And Jan Lee is asking, I want to analyze big health data and tackle global health, global issues such as COVID, for example. And that's noble. And also the question is, does this program help?
Yes, well, maybe you saw it when I mentioned my examples of the scientific research projects. I showed one example of a student who analyzed the process of admitting people in, I think, the ER with COVID. So yes, COVID was really and still is an important research topic. And many of our teachers are also researchers and very heavily involved in analyzing lots of data concerning COVID. Yes.
And then the final question from Jan Lee also, if I start my pre-master in September and join the master in February, won't I miss out on the first semester of the master program? Is the program from February completely separate from the September program?
You actually get to know more people, actually.
Yes, so if you start in February, then you follow the second semester of the first year. And after that, you follow the
first year of the
first semester of the first year. Then next you first do your internships, your elective courses somewhere, and then you can do your SRP. So you don't miss anything.
Yeah.
Well, that was it then.
Thank you all for your attention and good luck with your choice. We hope to see you in the pre-master program and then in the master program.
And
goodbye.
Thank you from John Lee and everyone and around. So, great.
Thank you guys for the questions.